So this is November. It's Movember, actually, Men's Health Month. And I just want to give you some quick tips, men, some things you should be thinking about and that we'd love to help you with. Hi, I'm Dr. Angela Yeagley. Welcome to Sage Health TV. So this is the time you're probably going to be seeing a lot of ads out there. Men, get in to see your doctor. It's time to get your prostate checked. And that's really, that's actually really the message is it's kind of Prostate Awareness Month. And it's super simple to begin, actually. It's just a blood test that measures PSA levels. And then at some point, depending on your risk history, if there is a family history of prostate cancer, you want to come in and have what's called a DRE, or a digital rectal exam. We do annual exams here, but for men that aren't comfortable having a woman do that, what I do for my men where I'm, their primary care is I send them to a urologist, and then they have it done there. So it just becomes like an annual exam. So women, I think, are very used to this. We start our annual exams really early, usually like late teens, early 20s. So when I think that, what I hear from men is that, because it doesn't start happening until the 40s, that, it's awkward. It feels really awkward. You're like, that's, private. But it's so important because, this is one type of cancer actually that really can be treated early, can be found and treated early, and people can have really, really good results, from catching it early. And so, there's a big push this month to just raise that awareness. I also want to talk a little bit about it, just quickly, a couple of other things that I really like to see in men is your testosterone levels. Very, very important for a lot of reasons. Energy, metabolism. We just did a great video on metabolism that you should check out. As well as just, mental health. Actually, men who have really good testosterone levels tend to have much less risk of depression and anxiety. And so if you're struggling there, I know this has been a really hard time with the pandemic, that, really testosterone should be something that we put into your wheelhouse of checking. And then I like to see men as well, like your B vitamins. I also want to look at just other, estrogen, if you're carrying a little bit of weight, estrogen tends to be released from fat that's stored in the abdomen. And so if that's something that is there, we really need to look at your estrogen levels. And that's not something that's really brought up very often because it can also affect your prostate too. So, so then we just want to look at, like, vitamin D is super, super important, and is really going to help your immune system. And actually what's really cool about vitamin D is that healthy levels, good healthy levels have been associated with less risk of all cancers. And so, again, if that's in your family, then it's so easy. It's so easy to test and optimize. Like, let's do that for you. And the last thing would be just like making sure the other part that's in there is at age 50, getting your colonoscopy. Again, not sexy to talk about at all, but it's actually really quick and simple and easy. And because it's a preventative exam, you can go and just call your gastroenterologist, the local one, and say, hey, I'd like to come in. It doesn't require referral because, again, it's something you're supposed to do once every 10 years. So I encourage people to do that because, again, those are one of those things that it's fast, and you can find things that, little growths or polyps and things like that can easily be removed and prevent, colon cancer, which is really important. So please reach out. Would love to see you. A lot of times we get men from their wives or their girlfriends, and then they end up staying because they really like the care, and then, finding out a lot about themselves. So, don't have to have your wife bring you in. You can just make the appointment yourself if you like. So look forward to seeing you. Please reach out if you have any questions, and I will see you soon.